Okay, guys, we are back. Sorry, I'm just trying to figure out. Okay, never mind. Okay, so I had chapter 3, question 3. What about Pseudomonas aeruginosa makes it especially problematic in burn victims and cystic fibrosis patients? So, first, we're going to talk about what it is. So it's one of the most common types of Pseudomonas bacteria, and it's found in the soil and in contaminated water. It causes infections in the lungs, which is pneumonia, in the blood, and some other parts of the body after surgery. It is considered an opportunistic pathogen. It can be easily spread in places where people can be exposed to contaminated soil and water. Strands that have become resistant to the antibiotics can spread in the hospital through contaminated equipment, surfaces, or hands, which is why it's a problem for those in hospitals. So, again, why are they so dangerous? These bacteria are constantly becoming resistant to the antibiotics, so when they're administered to the patient, sometimes it won't stop the infection. Um, and those who are most at risk are in hospital settings and are people on ventilators, people with catheters, and those with surgical wounds or burns. The extra danger for those with cystic fibrosis. 60% of people with CF have recurrent respiratory infections caused by this bacteria, and once it has embedded itself into the thick mucus, it's very difficult to get out, and this is the leading cause of death in CF patients. They experience chest pains, fevers, weight loss, wheezing, and a cough, and I also read that it can sometimes be like sweet smelling, which I thought was kind of weird. Um, and for burn victims, this bacteria can cause sepsis in burn victims if not prevented. It's one of the things that doctors and surgeons check for the most because of how common it is. One that's manifested in the wounds, just like in the lungs of cystic fibrosis patients, it's very difficult to remove. And due to the impairment of the skin barrier in burn victims and the frequent scrubbing and manipulation of the burn site, this bacteria is more likely just because of how exposed people's skin are. And this is my works cited. Hope this answered the question for y'all.